Safaa, so you have had a liver transplantation operation in Acıbadem Bursa Hospital. So we would like to know a little bit about yourself. So could you please introduce yourself to us?
إني صفاء حسين علي من العراق. مواليدي سنة 1948. عملي صناعة الأقمشة وبيعها واستيراد المواد من تركيا.
So now you have had your operation. How are you feeling after this operation?
هسه انت سويت العملية، شنو إحساسك بعد العملية؟ بس تتنفع.
إني مرتاح جدا بعد أن أجريت لي العملية، وأشعر بالطمأنينة على حياتي من جديد بأني قد ولدت.
And now you are with your doctor, Professor Dr. Remzi. So would you like to say anything to him?
انت هسه دكتور رمزي تحب تقول لك شيء؟ بس بدون فعل.
أنا أشكر الدكتور رمزي شكر.
You're welcome.
والله.
Nice to meet you.
على هذا العمل الإنساني قبل أن يكون مهني، عمل إنساني الذي أنقذ حياتي. وأشكر جميع الكادرين الكوادر الموجودة في المستشفى، كلهم كانت خدماتهم ممتازة وجيدة.
3 weeks ago, and we did the operation 2 weeks ago. And when he came, I feel that he is very weak, but after some time, I see that he is stronger than he has seen. During the follow-up and during the evaluation, we find out that he had hepatorenal syndrome, and he had 2 masses in the liver, and they seems to be the hepatocellular cancer. And there was 2 donors with him, his son and his sister. We evaluated his son, but we found that he has fatty liver. So we tried to evaluate his sister. Although she was 106 kilos, the liver function tests and the liver structure was normal, so we performed the liver transplantation. We take the right lobe of the donor and we transplanted the liver to Mr. Safaa. It was a very good operation. We didn't have any complications, and now we are ready to discharge him. And I am very happy to meet with him. He is a very good and very excellent man. So I hope he will have a very long and good life. I'm a general surgeon and liver transplant surgeon in Bursa Acıbadem Hospital. I am doing liver surgery since 1998, and then I started to work in Acıbadem Hospital. It's been a year in this hospital, and we are doing both living donor and cadaveric donor liver transplantation in this center. We have a very good team, and we have every kinds of equipments and very sophisticated operation room. So this hospital is very good place for these kinds of surgeries. And we had very successful surgeries. This year we had 16 cases till March. And we also accept patients from foreign countries, for example from Libya, from Iraq, we have patients. And in these patients we are mostly doing living donor liver transplantation.
How did you learn about your father's disease?
In 2007, my father's health deteriorated rapidly all of a sudden without any introductions, and he was taken to the hospital to stay there for a week. During the diagnosis process, we discovered that he has something related to liver disease, but it was not identified immediately. Afterwards, we took him to the private clinic, and then the disease was diagnosed. We tried different kind of treatments for him at the very beginning, and day by day we discovered that his situation was not that good as we expected it to be. And at the end of 2010, we discovered that the majority or the major part of his liver is not good, not functioning at all. And now in 2012, we were told that his health has deteriorated seriously, and that there is no choice but to do liver transplant.
How did you keep in touch with Acıbadem Bursa Hospital liver transplantation unit?
At the very beginning, we did not find any way to contact anybody inside the country and outside the country. By chance, we found a medical term in Erbil, in the north of Iraq, and those people offered their help. First, we did some medical checking for my father's liver, his blood, and a couple of things. And later, they informed us that my father urgently needs a liver transplant surgery. We asked them about what are the best options we have, and they suggested Turkey, Bursa, Acıbadem Hospital. And they told us that we have to move there as soon as possible. We started the process of... We first actually made the decision that we have to take it or not to take it. We decided to take the risk and come here. And here we are. Acıbadem, Bursa.
Okay, so you, of course it was not really easy decision for you to do your father's liver transplantation in abroad, but how did you decide to move to Turkey?
First, we contacted that firm I told you about, and they contacted Acıbadem directly. They contacted the headquarters in Istanbul, and they sent you a notification about our coming here. We came to Istanbul on the 3rd of August. A car was waiting for us with a translator who told us about the way and how long our journey is going to be. We came here at the appropriate time. Immediately upon our arrival, things started. The checking and the tests and all that stuff. At the very beginning, I was expected to be the donor, but unfortunately I discovered that I have fat in my liver. Then my aunt decided, or she was already prepared to be the donor, and the test started with her liver. She proved to be okay, and her liver was, or part of her liver was taken from her and given to my father. During the preparation, everything was good and fine. We were psychologically and physically prepared for the operation. My father was healed from a number of diseases he suffered from before the operation, and the operation proved successful, thanks to Acıbadem and to Dr. Remzi, who conducted the operation.
Okay, I see. So, I'm sure that Mr. Amar, it was not really easy decision for you to take your father for such a major operation to abroad, but now you're in Turkey, in Bursa, Acıbadem Hospital, and your father has had his operation. And also about the service that you received, what would you like to tell us about it?
For the decision, it was a kind of life and death issue. We had either to do the operation and save my father, or, God forbid, let him die. And this is something we don't want to do at all. So we took the risk, as they say, and we came here, and everything here proved to be okay. The medical team proved to be highly efficient and qualified doctors. The nurses are efficient and dedicated to their work. Every kind of service here proved to be great. The translators, the admin, everybody here was nice, soft, and tender to us, and everybody helped us in different ways. And this is my first visit to Bursa, but I have had great time with good friends. I never felt that I'm in a different country, because everybody was supportive.
Thank you very much, Mr. Amar, for your comments.
Welcome.
Thank you.